Medical tourism. What is it, and why are so many people doing it? The Deloitte Center for Health Solutions recently published an article saying that more than 500,000 people every year travel outside the United States for medical services. That's a lot of people. Why would so many people do that? Well, it turns out the U.S. healthcare services are terribly overpriced by U.S. standards. There's a booming market of Americans and actually people worldwide who travel abroad for medical services. They travel to places like Costa Rica, China, Mexico, Ireland, even the United States for the medical services that fit their personal needs best. There's many reasons to travel abroad for healthcare. The three primary ones are cost, quality of care, and availability of care. Now, in the U.S., one of the primary factors, of course, is cost. Here in the U.S., our costs for medical services are astronomical. They carry a heavy burden for those people who have healthcare insurance, but for those people who have no healthcare insurance, it can bankrupt them. Now, there's a 2008 Census Bureau report that shows that about 15% of Americans had no health care coverage, and about 45% of Americans had no dental coverage. But there's a lot that's happened since 2008. We've had an economic downturn on a global scale that has significantly affected the number of people in gainful employment. Now, most people get their health care coverage from their employers, so this means that our numbers of people without health care coverage and without dental coverage have climbed significantly since that 2008 census study. Some examples of ways that people can save by traveling abroad for their health care coverage can be listed as follows. Now, if you wanted to have a hip replacement done in the U.S., you'll spend somewhere around $45,000 to $92,000 retail price. But if you travel to India, you can do the same thing, including all your travel costs, for about $9,000. That's a 90% savings. A lap band surgery or gastric bypass surgery might cost $32,000 in the United States retail, but you can travel to Costa Rica and do the same thing for about $12,000. And a dental bridge in the United States, to bring things down to a little bit smaller scale, dental bridge might cost $2,500. In Mexico, you can spend more like $250. That doesn't include travel, of course. And you might think that you have to sacrifice some quality of care to get these savings. And you do need to do your homework, of course. We probably need to do more homework on our providers at home. But there's bodies such as the JCI, Joint Commission International, the Patients Without Borders, and the ISO standards for hospitals, which allow us to have some vision of what quality of care we should expect from these hospitals, from these providers, and from these doctors. In addition, you can look to resources such as travelingforhealth.com for personal stories and reviews about these providers. Often we find that our medical services in these areas that cater to medical tourism put a high importance level on their quality of care. After all, you'll find that the quality of care directly connects to the reputation of these providers. And reputation is everything to a provider or a clinician who is basing their business on drawing people from around the world for high cost and high risk operations. If their reputation isn't good, no one's going to travel around the country to let them perform these procedures. Now, a third incentive is availability of care. The best way I can explain availability of care is to bring you a first-hand account that you can find on our website. There's a story there that you can read about a Parkinson's patient. He was nearly wheelchair bound from the extent of his disease, and he had watched his father experience similar results. His father had died a very slow and painful death from the same disease, Parkinson's. He didn't want this for himself, and he began to do his research. After following the research, he found a clinic in Costa Rica offering stem cell therapy that had had some success with Parkinson's. The stem cell therapy is not available in the United States, and so he decided to travel to Costa Rica. Now, after only a few short weeks of therapy, he was able to walk upright without a cane and without pain. This is one example of a patient making a personal choice about the medical care for himself, shopping a global market, and taking steps to control his own care. Medical tourism is becoming a surprisingly popular alternative to local medicine. The extremely high cost of modern medicine has brought an economy of scale to the industry. World leaders in medicine have chosen to build world-class facilities and bring world-class doctors on board. And on top of that, have brought a sense of customer service into the facilities. Lastly, the availability of care issues, such as traveling abroad for a procedure that you might not find locally, allows patients to shop in a global market and make choices about their care based on their own personal needs and personal opinions. Medical tourism is never going to replace the local practitioner doing your regular routine exams. It's not going to replace our local emergent procedures such as what you might find at an emergency room. But for these non-emergent, high-cost procedures or regular maintenance procedures when you have the availability of traveling across a close border such as into Mexico, you'll find that medical tourism is one way that our world is getting just a little bit smaller. For Traveling for Health, this has been Tim Nichols.